Joining me now is Canada's Chief Public Health Officer, Dr. Theresa Tam. Dr. Tam, nice to see you this morning.
Hello, Rosemary. It's nice to be on your show.
I want to talk a little bit and reflect a little bit about the past year, but I think we should talk about some of the concerns that are present now, specifically the variants of concern. This does, I think, is top of mind for a lot of people, and as many parts of the country are moving out of restrictive measures, those variants are still present. How concerned are you about whether those variants are going to lead to a third wave, a fourth wave, and other things that we maybe are bracing for?
Yes, so the virus constantly mutates, and particularly in areas where there's a lot of infection, the virus mutates more. And we've seen this happening in different parts of the world. So we are closely monitoring several of these variants that you've probably heard about, ones that emerge from the United Kingdom, South Africa, Brazil. And the really important thing to understand is that we need to really step up testing and screening for these variants and have all the other public health measures in place, drive the epidemic curve all the way down before we can begin to sort of ease those measures slowly and with careful monitoring. We do know, though, the good thing is that these variants, even though they can spread more readily, more quickly, can be controlled by the public health measures that we have.
Go ahead, sorry.
Yeah, the other aspect, of course, we're monitored for, particularly as the vaccines are rolling out, is whether these variants have any impact on the effectiveness of the vaccine. And so that's still, we monitor that really carefully. And, that there may be a bit of impact, but we expect the vaccines still work. And that's the important thing to remember for now. But this is why we must be really vigilant, extremely vigilant, and don't lose patience right now, just as the vaccine programs are underway.
Well, I'm glad you said that, because it does feel like as more vaccines are coming into the country, and we've got a sort of increased timeline in terms of when we might get vaccinated, that people are hopeful, but maybe also the caution that we have been living with is dropping a little bit. How concerned are you, or what would you say to people who think that the vaccine is the answer to getting back to regular life pretty quickly?
Well, the vaccine, I think, as all of us are sort of feeling the same way, is that they offer a great deal of hope because they are so effective. So all the vaccines that are being authorized right now, there's 4 and essentially 5 of them if you count the Serum Institute of India's version of the AstraZeneca vaccine. They're really effective at preventing serious outcomes, hospitalizations, serious illness. So we're buoyant by that sense of optimism, and the vaccines are going to play a key role. But what we have to do right now, as the vaccine is just escalating, and we'll see the delivery being accelerated and people getting vaccines in their arms during this critical next months, we have to be vigilant. But I think we can be buoyant by that more optimistic outlook, because it's a pretty tremendous thing that we have, which is several, not just one, but several really great vaccines. But then with that sense of optimism comes the need to just hang on in there for a bit longer. Because I do think that if these vaccines are provided to as many people as possible, we can break the most severe consequences, the crisis phase of this pandemic. And so I think, that's the what we have to do for now. As we reflected from the beginning of this pandemic to now, we've now developed some really good personal habits. Got to keep on at it, whether it's wearing a mask, washing your hands, or watch your distance. Try to assess the risk of the setting that you're going into. And so avoiding, closed, crowded conditions are still the fundamental foundations.
Let's talk about the vaccines and the efficacy a little bit. I did talk to Dr. Sharma last weekend about this, but now we have another vaccine, the Johnson & Johnson vaccine or the Janssen vaccine, the one-dose vaccine that's been approved. And Canadians are getting a lot of information about efficacy and percentage numbers. Are you concerned that that could contribute to vaccine hesitancy or vaccine shopping, as we're calling it?
Well, I think you're right in that people are just watching numbers and they're just trying to compare them. But you can't really compare these vaccines head to head. What is the fundamental fact about these vaccines is that they are all very effective when it comes to preventing serious outcomes, such as hospitalization, such as really serious illness and maybe death as well. Not just from the clinical trial. We've now got lots of millions of people having been vaccinated in other countries shows us that is the case. These vaccines are effective for that purpose. They may have a different range of effectiveness when you see those numbers against milder illness. That's possible. But all of these trials were done in different countries at a different moment in time. So I think people should feel very confident as they go in to get whatever the vaccine is being offered to them, that they are really great for that purpose.
Okay. We talked about the public health measures and how we need to keep them up as the vaccination process unfolds. But I think a lot of people are wondering, how long do we have to keep them up? Are we talking about another year, another 6 months of mask wearing and social distancing? What is your expectation?
Well, I think we can be increasingly optimistic about all of that. What we would like to strive to do, and this is all up to everyone doing things together, is to get one dose into everyone who would want the vaccine as fast as possible because of that effectiveness of that first dose, and then coming back with the second dose during the summer months or sooner with more supplies. What that would do, I think, is to allow us to have a summer that is safer, with more abilities to do some of the things that we look forward to, while shoring up and boosting our capacities and our immunity prior to the fall, so that we break, as I said, the crisis phase, so that we want to avoid going back to these lockdowns and more restrictive public health measures. But keeping up with your personal measures, I think we're going to see that we'll be doing that kind of thing, developing them as a habit for many months to come, for many reasons, because some of the uncertainties that we said about the variants, but other countries also don't have the vaccine as fast as we do. So these viruses, can come in invisible ways. And so we need to be able to keep up those measures. Even the most effective vaccines, let's just say 80%, of preventing serious outcomes, there's still people who are not going to be protected by the vaccine. So with that in mind, I think these habits are going to continue for some time, but we want to stop the more restrictive measures as soon as possible.
I just have about a minute left, Dr. Tam, but what is the sign that you are looking for when you will know that we are at the end or near the end? What are you watching for?
Well, many things. Obviously, close monitoring of that epidemic curve that everybody's learned about, so that if you see any accelerations, that's not a good sign. That's not the time to relax. We want to see hospitalizations and deaths going down. That is really important. And we have to monitor to make sure, as I said, the vaccine effectiveness continues. So with all of that in mind, though it's not a single indicator, but it's a composite one. And so I think that is where we'll arrive at a good place. And we need the world around us to be there as well.
Okay. Dr. Theresa Tam, good of you to make the time this morning. Appreciate it very much.
Thank you.